This is fantastic. This state-of-the-art technology.
Wonderful. All right, then. Nice having you in our studios once again.
Thank you.
All right. So I understand September is Prostate and Ovarian Cancer Awareness Month. Any particular reasons why this has been designated as such?
Well, we have several type of oncology, and somehow we have designated different months for different cases.
Okay.
Worldwide, September has been designated for prostate and ovarian, and that's how it is every part
of the world.
Yeah.
So it is looked at as an awareness month globally, not just in Nigeria.
No, not just in Nigeria. It's globally.
So let's jump in on the area of focus now. So prostate cancer. What kind of a cancer is that?
Prostate cancer is a cancer that, if you are able to detect early, has very high chance of cure, as opposed to many other cancers. Prostate cancer also is more common among elderly men. So there is time to really do screening, and it can usually be family linked. It can be familial, and
that means it can be inherited.
It can be inherited.
So yes. you will not find prostate cancer among young people?
No, we can't. Every man can have prostate cancer.
Any man, even a 25-year-old man?
No, I think every man, as you grow older, you can have prostate cancer. Prostate cancer is actually the most common cancer in men, and it's usually uncommon below the age of 40.
Okay.
But as the man grows up, as you age, which is the most important factor in prostate cancer, that's the age. As you age, your likelihood of having prostate cancer increases. So if you have a family history, a strong family history of prostate cancer, the risk also doubles. It increases multiple fold than those who do not have.
Right.
However, if you grow old enough, you will have prostate cancer.
So how common is prostate cancer across the world?
Prostate cancer is the commonest male cancer, and it's only second to breast cancer, which is the commonest cancer. Breast cancer and in this part of the world, and the lungs in the Western world. But prostate cancer is the commonest if you take men alone. It's the most common. And not all prostate cancer are very aggressive. Many cases, most of the cases are indolent. What I mean is that most times prostate cancer is not aggressive. Okay. So in fact, most people don't know they have prostate cancer even when they have it, because it's usually very low pace.
So I'm asking how common, because I want to know if there are 10 men in this room right now, how many are likely going to have prostate cancer?
If there are 10 men that are age 80, like I said, it's age related, then about 8 of them will have prostate cancer, but only about 2 or 3 of them we have the sign and symptoms of prostate cancer.
Wow.
So if there are 10 men of 30 years old, most likely none of them will have. Yes.
10 men of 40 years old?
10 men of 40 years old, that's when it starts. That's when we start seeing maybe one or even less.
10 men of 50 years?
10 men of 50 years, maybe about 2.
Or 3.
And
then from 60, the number begins to increase.
The number rises from 60, yes.
Right.
Yes.
Okay, so those that are listening to us right now, some might not really understand. We're just saying prostate. Which part of the body is the prostate located?
Yeah, the prostate is located below the bladder. Usually we say the neck of the bladder. And the function of the prostate is to secrete those substances that you see in semen. The seminal fluid and the components are secreted by the prostate gland. So it's a reproductive organ. It helps to nourish the sperm.
Okay.
Yes.
So it can only be identified. It's not something that one can see outwards.
No, you can't see it. You need imaging. Okay. You need either a scan or a CT. You need scan to see it.
Right.
It's not something that is visible physically.
So how does it compare with other kind of cancers?
Prostate cancer, like I said, is one cancer that is easy to cure, because it's usually not aggressive. So if you do screening, you can detect it early. And prostate cancer is one cancer that you can treat by manipulating hormones. I know many people don't want to hear chemotherapy. So you can treat prostate cancer if you detect it early, even without chemotherapy. Yes, if it's detected early. You can do hormonal manipulation, you can do surgery, you can do radiotherapy without chemotherapy.
So what causes prostate cancer then?
age is the most important factor, apart from being a man, because prostate is only in men.
Yeah.
So the second factor is aging. As a man ages, the risk of having prostate cancer also increases.
Right. So could you also be adduced to sexual intercourse? I mean, intercourse or that kind of a thing?
There are many researches that have tested this. And the only thing that we see that can prevent a man from having prostate cancer is if you castrate the man at a young age.
Oh.
Apart from that, any other thing has not been found. Well, maybe also sedentary lifestyle may also increase the risk.
Right.
Sedentary lifestyle. Apart from that, most of the time it's only as the person ages or if there is a strong family history of the cancer.
So if I'm celibate,
If you can still have it.
You mean it?
Yes.
Even if I don't
you don't have anything, you
with
can
a woman?
No, you can still have it.
Ah.
Yes.
Why is this cancer being like that now? Why is it so stubborn like that? All right. So let's look at the signs and the symptoms of prostate cancer. What are some of the signs?
Yeah, the commonest signs are linked to problem with passing urine. Either having urinary retention, that's not able to pass urine, or hesitancy, not able to withhold urine, or painful urination, blood in urine. Most of the time it's linked to urination. However, when it spreads, then you now start having the sign of spread, like backache. Usually, prostate cancer has propensity to spread to the backbone. Okay. So you can have backache, you can have hip pain in the hips. Some people even prevent with fracture. What we call pathological fracture. Maybe they just jumped a gutter, then the bone got fractured,
wow.
Because it attacks the bones. Once it leaves the prostate gland, usually the first place to attack is bones. So you can have bone pain, there can be loss of weight, unintended loss of weight, all these are usually associated. The most common problematic presentation is an elderly man coming in with inability to pass urine. Even though he's pressed. He's not able to pass the urine, but he's pressed. So it's very agonizing. And then you need to catheterize to relieve the urine.
Right.
Yeah.
All right. So the prostate glands, oftentimes we hear of prostate enlargement, right?
Yes.
So once it enlarges, does that mean the person will likely come down with prostate cancer?
No. The enlargement also might might have similar symptoms, but usually does not spread, does not cause backbone and all that. And it is called benign prostatic hypertrophy. It is benign, while prostate cancer is malignant. So there are two different diseases. So yes, the BPH, which is benign prostatic hypertrophy, does not spread. So it can only cause urinary symptoms. It doesn't have anything to do
So one need not to be scared.
Well, we need to treat it, because once it also causes urinary retention, it will also give a serious problem, because when you are pressed and you can't pass urine, it's a very serious, but it's not as debilitating as prostate cancer, because it usually will not kill. It will only give you some problem that will make you rush to the hospital,
right.
And then there will be intervention.
All right, so Dr. Habeebu, are there things that I can do to prevent prostate cancer as a man?
Well, there are things you can do to slightly reduce the risk, and there are things you can do to prevent morbidity and fatality from prostate cancer. Okay. So you need to do exercise as a man, some degree of exercise. Don't live a sedentary lifestyle. You need to eat right, balanced diet, but more importantly, you need to do screening, PSA screening.
Okay.
Yes.
That's a test?
Yeah, that's a test.
So how often should I go for that test?
Not less than it. Well, if there is no problem, then you can do once a year or once in 2 years. That's if your PSA is very low. But if your PSA is borderline, then you have to increase the frequency. Okay. There are other tests, but that one is the less invasive one. You can also see a doctor to do a digital rectal examination, and you can also do scan imaging of the prostate. But PSA is the one that you can just go to a lab and do. You don't require, much issues to do.
So can prostate cancer be cured?
Like I said, prostate cancer can be cured if it is caught early. If you catch it early by screening, then it can be cured. But when it has spread and it to other parts of the body, it will be difficult to cure.
Wow. So that's the way it is, just like other cancers.
Just like other cancer. Only that usually prostate cancer takes a longer time to spread. Usually it's a slow growing cancer that takes a long time to spread. But not in all cases. We have some aggressive variants that can, spread faster.
All right. So for you men that are listening to this, I think Dr. Habeebu is bringing both good news and some element of bad news. But it appears he's bringing more of good news than the bad news. Let me see if I can just leave the lines open for 3 minutes before I allow him to leave the studio. 08099 120777 and 09153877127. We're talking prostate cancer. It's September and it's a prostate cancer awareness month. So if you have any questions for Dr. Habeebu this morning, feel free. He's of the NSIA-LUTH Cancer Center. It's treatable, you said, right, Dr.
It's treatable,
Habeebu?
very treatable. There are many modalities for treatment, yes.
Right. This one says, good morning. How does prolonged sitting while driving impact prostate health? Okay, you didn't put your name, by the way.
Well, as long as you do exercise, maybe once a week, prolonged sitting does not really affect the prostate as such.
Okay, so drivers who drive for a very long period should not be scared.
They shouldn't be scared. There is no problem at all. So long as you do your regular exercise, sitting for long has no issue with prostate.
Okay, then this one says, good morning, Victor. Are professional drivers at a higher risk of developing prostate cancer compared to other occupations? This is Okpeoluwa sending this one. I think you just responded to that as well. This one says, good morning. How does age affect the risk of developing prostate cancer, and where should men start getting screened?
Age, the older you grow, the higher the risk. So they are directly proportional. It is said that about 80% of men will have prostate cancer at the age of 80 years. The time to start screening is 40 years. Okay. If you don't have a family history, you can start by screening at 30 years if you have a very strong family history. And the easiest screening you can do is PSA, but you can also do scan of the prostate, either CT scan or MRI preferred. Or you see a doctor to do digital rectal examination. But you can easily walk into any lab and do PSA, which is prostate-specific antigen.
Right. So once you ask for that, they'll be able to tell you the status of your prostate, right? Good morning. This one says, good morning, Victor. Are professional drivers at a higher... I think we just... Okay, we've taken that. This one says, how does age... Okay, I think we've taken that one as well. This one says, good morning. Are there preventive measures drivers can take to reduce pressure on the prostate while sitting for a long period? Ainde from K2 sending that one in.
Okay, well, a driver can do exercise. Okay. That's what you can do, but it's very important to do screening, to do your PSA, regularly.
Regularly. So how regular? 6 months or 1 year?
If you do it the first time and the figure is much less than 4 nanogram per ml, 4 is usually the cutoff, then you don't need to do it maybe for another 2 years. But if you're having figures that is like 6, 5, 6, depending on if you don't have symptoms, you may do it more frequently, like 6 months. But if you have high figure above 10, immediately you report to your doctor.
All right. This one says, can prostate cancer spread to other parts of the body? And if so, how is it managed? You didn't put your name, by the way.
Prostate cancer can spread to other parts of the body, just like every cancer. And how it's managed is to investigate further by doing scan, maybe CT scan, and other type of scan to identify the area the prostate cancer has spread to. Then you treat both with systemic, either hormonal manipulation, chemotherapy, and then you also use radiotherapy to target those areas and burn the spread off, if it's where possible.
Okay, then. So, Dr. Mohammed, as we gradually wind down, how can we care, or how do we care for people with prostate cancer?
Prostate cancer requires multidisciplinary care. That's, you have different specialties that comes to review the case, like the urologist, the oncologist, the radiographer, the radiodiagnostic physician, the pathologist. We come together to chart the best way for each patient. It's personalized treatment. And there are many modalities, including surgery, radiotherapy, chemotherapy, hormonal manipulation, and targeted therapy for prostate cancer.
So the very final question I'll ask men. So anybody who comes down with prostate cancer, can he still continue to perform his function in the other room?
It depends on the stage of the prostate cancer. If it is caught very early, yes, it will be able to perform everything normally. Yes. Okay. However, if it's caught very late, it may not be able to do that.
Wow. Okay then. Well, very good information this morning. As we wrap up on the program, Dr. Habeebu, what's your message to our listeners?
My message is that you must do screening. When you age 40, do PSA test and the other form of screening regularly. And even if the unwanted cancer comes, you will knock it out.
Nice having you in the building. Thank you so much for being here.
Thank you for having me.
All right. So I've been speaking with Dr. Muhammad Yakub Habeebu. He's a consultant oncologist and, of course, he's chief clinical coordinator at the NSIA-LUTH Cancer Center. I hope you've been able to get one or two things. I'm going to switch gears right now to celebrate you, do our birthdays before we change to Build Right.